This medication is used to treat or prevent certain types of headaches, such as migraine headaches and cluster headaches. Ergotamine helps narrow widened blood vessels in the head, which reduces the throbbing effects of vascular headaches. It is important to take this medication as directed by your doctor. The usual dosage is 1 tablet placed under the tongue at the first sign of a migraine. Do not take more than 2 tablets in 24 hours. Take this medication with plenty of water. Pay attention to the timing of your headaches and take the medication at the first sign of a headache. Place 1 tablet under your tongue and let it dissolve as instructed by your doctor. Avoid chewing or swallowing the tablet and refrain from eating or drinking while it is dissolving. The dosage of this medication depends on your medical condition and how you respond to the treatment. It works best when taken at the first sign of a headache. Waiting until the headache gets worse may result in the medication being less effective. Usually, this medication should only be taken as needed and not for long-term daily use. The maximum dose is 3 tablets in a 24-hour period and 5 tablets in a 7-day period. If you suddenly stop using this medication, you may experience withdrawal symptoms such as rebound headaches. Your doctor may gradually lower your dose to help prevent withdrawal. Withdrawal is more likely if you have been using ergotamine for a long time or in high doses. Inform your doctor or pharmacist immediately if you experience withdrawal symptoms. Using this medication for migraine attacks on 10 or more days each month may actually make your headaches worse. Medication overuse headache. Do not use the medication more frequently or for a longer period than directed. Inform your doctor if you need to use this medication more often or if it is not working as well, or if your headaches worsen. If you experience nausea, vomiting or dizziness, it's important to tell your doctor or pharmacist. Many people using this medication do not have serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as changes in heartbeat, tingling or pain in the fingers or toes, muscle pain or weakness, or signs of kidney problems. In very rare cases, a serious allergic reaction may occur, so seek medical help if you notice any symptoms of a serious allergic reaction. And remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Ergotamine tartrate tablets, sublingual, can rarely cause a serious lack of blood flow to the hands and feet or to the brain, which could lead to a stroke. This risk is increased when taking this medication with other drugs that can affect the removal of ergotamine from your body. Examples of these drugs include azole antifungals, cobicistat, mifepristone, certain antidepressants, macrolide antibiotics, HIV protease inhibitors, ritonavir, and SSRIs, among others. It is important to consult with your healthcare provider before taking this medication to ensure it is safe for you. This medication is used to treat migraines and cluster headaches. The usual recommended dosage for adults is 2 tablets at the first sign of a migraine, with an additional tablet every 30 minutes if needed, up to a maximum of 3 tablets in a 24-hour period. It is best to take this medication as soon as the symptoms of a migraine appear for the best results. Before taking this medication, it's important to talk to your doctor or pharmacist if you have any allergies to ergotamine or other similar medications. This product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have conditions such as high blood pressure, heart disease, liver or kidney disease, or if you are a smoker. It's important to note that this medication can make you feel dizzy, and using alcohol or marijuana can increase this feeling. It's best to avoid driving or using machinery until you know how this medication affects you. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you use marijuana. It's also important to be aware that using tobacco or nicotine products while taking this medication can increase the risk of serious side effects, such as heart problems. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. It's also important to note that this medication should not be used during pregnancy, as it may harm an unborn baby. If you are pregnant or planning to become pregnant, discuss reliable forms of birth control with your doctor. Additionally, This drug may pass into breast milk and could have undesirable effects on a nursing infant, so breastfeeding is not recommended while using this medication. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without your doctor's approval. If you take triptan migraine drugs, such as sumatriptan or rizatriptan, you should separate your triptan dose from your dose of ergotamine tartrate tablet, sublingual, to reduce the risk of serious side effects. Ask your doctor how long you should wait between your doses of these drugs. Some products may contain ingredients that could raise your heart rate or blood pressure. Be sure to inform your pharmacist about all the products you are using and ask how to use them safely, especially cough and cold products, diet aids, or other migraine medications. If someone has taken too much ergotamine tartrate tablet, sublingual, and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of an overdose may include severe dizziness or drowsiness, loss of feeling in the fingers or toes, rapid or weak heartbeat, and bluish hands or feet. It's essential to get help right away in case of an overdose. It's important not to share this medication with others. There are certain foods, beverages, and food additives, such as red wine, cheese, chocolate, monosodium glutamate, and alcohol, that can trigger migraine headaches. Additionally, lifestyle patterns like irregular eating or sleeping habits and stress can also bring about migraines. Avoiding these triggers may help decrease the frequency of migraine headaches. If you want more details about managing migraine triggers, consult your doctor. As for the daily dosage of ergotamine tartrate tablet, sublingual, it is typically taken at the first sign of a migraine headache. The usual recommended dose is 2 tablets placed under the tongue. If the headache persists, another dose may be taken after 30 minutes, with a maximum of 3 tablets in 24 hours. It's important to follow the instructions from your doctor and not exceed the recommended dosage. Remember to always consult your doctor before starting or changing any medication. If you forget to take a dose, take it as soon as you remember. If it is almost time for your next dose, skip the missed dose and take the next dose at the regular time. Do not take a double dose to make up for the missed one. Make sure to store ergotamine tartrate tablet, sublingual, at room temperature, away from light and heat. It's important not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard this product when it's expired or no longer needed. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.